Yeah, today the topic for me is migrant and COVID. I look at it as they're seen everywhere. We're seeing them on TVs, we're seeing them on the roads, but their voices are not heard. Uh, we, s- the migrant crisis is actually a collateral damage that happened as part of COVID with the announcement of the lockdown on March 24th. The migrants got, all of us got only 4 hours notice. Possibly we were all able to manage. But for the migrants who lived far away from their homes, it was a total disaster. We have 40 million migrants who are working in and around. And as until that time, they were hardworking, earning their own incomes, standing on their own feet. The 4 hour notice period with no options that they could do, they lost all their dignity and respect. And overnight they came on the roads because they didn't have their jobs, they didn't have their salaries, they had no money to buy their foods, and they were thrown out of the rental premises that they were living in. Back on the roads, many of them, some of them had houses in the slums wherein they could stay for 1 more month, 2 more, 1.5 months, and at the end of it, some of them landed up in the shelters that the government had set up with the support of the NGOs. This was possible with the central government funding of 11,000 crores to augment the state disaster management response fund. If you look at COVID, it has affected 200 plus countries across the globe. It was only in India that we saw such a massive migrant crisis. They suddenly became an underclass of citizenry where they had nothing to stand on. And that brought us to visibility the inequalities and the massive deprivation that they faced. They also did not have the country's legal protection, nor did they have social structures and the database to tell us who these migrants were and where they were. To add to this, the epidemic had caused a whole lot of anxiety among people. And here they were in large masses walking on the street, not able to practice social distancing, either in the places that they lived or in the routes that they took. One of the, when I went and met the migrants, one of the first things that they said is, if there's something called COVID happening, why is that our health checkup is not done? How do we know that we are not affected? Give us our money. We don't have money for the next month. We don't have money to food to buy, money to food, for the food to buy. We don't have, we are concerned about our families down at home. We want to immediately leave. In the shelters, they were not used to living in large numbers, and these shelters were possibly NGO homes where they had 1 or 2 toilets, and these toilets could not be managed for some 30 people to 50 people who were accommodated there. The situation of the shelters for the homeless was even worse because they had around half the numbers who had physical illnesses, and they were put in the shelter with no doctor to really oversee. We have been hearing this on the TVs that migrants have been dying, some of them out of starvation. If you look at the data, we have 676 people who have died in up to 30th May. A lot of them died out of starvation, some of them because there was no medical care. A few of them went and died by suicide. There were police brutality we saw, and we had people died because of the complication, the sudden withdrawal of alcohol causing death, and people walking on the road through exhaustion, they also died. So if you look at it, it was a massive problematic situation that India was facing. Migrants come to the cities, not that they do not have food at home to eat. They have difficulties because they have their poverty has been extreme. Their continuing indebtedness has been there, but In that process, it was the employers who actually shrugged their responsibilities and left them to fend for themselves. Their contractors had no way to handle them. And in that process, where they had no money, they were hungry and on the street without a full roof to cover themselves, they chose to walk miles and miles on foot. And when they really had to go through this, there was nobody to stand by them. There was no transport that they could take. And they had to start on foot because they looked at the world becoming to a complete point of no support. Many of them, as I told earlier, had died on the way, and there was absolutely no dignity in their life or in death. When I spoke to them, and when I asked them, why did you wait for some more time? They said, their words were, we do not want to die in the city. We would rather go home and die there. And that's what made this journey of traveling home an important part for them to be with their loved ones in the comfort of their family. This has brought to forefront the very stigma of being a migrant. They leave their cities because there's rural distress, because of the agricultural mismanagement. The official policies have been inadequate to really support the ailing rural economy, and they have no other sustainable livelihoods back home. There's this growing stigma that migrants faced because they were thought as the carriers of the infection. People were feeling that they were actually put in almost in lock and key, because it was felt that if you let them loose, they will go and infect everybody. And it was almost disenfranchising them of their rights to move. And that increased their possibility of not being really considered as valid citizens of the country. We have to realize that migrants don't leave their shores just because they do not have food to eat. They come out of the city for an upward mobility in life. And, and in this context of COVID, they were severely exploited and were also made powerless over their own lives and on their decision making. We need to understand that many of the migrants who come to the cities belong either to the scheduled tribes or to the scheduled caste. Many of them work in unorganized sectors and are primarily daily wage laborers. The sad part of it is that we do not have counts on how many people have migrated to the city, from which state, who are there. And when they were deprived of their labor and access to rightful benefits, there was no way you could say that, okay, we'll reach out to these people. It was very random. We started feeding people without knowing who they were, how many were there. We had to just depend on the phone calls that they made. So there was no data that was available. When we look at the women who migrate, if you look at the national data, it tells us that most of the women migrate because of marriage. And those who do or who have migrated because of other reasons, they land up as domestic workers, healthcare workers. If you look at the whole healthcare industry, it's very women-centric. The women daily laborers and the construction workers. The sad part of it is that they are lowly paid and are given menial jobs. Many of them enter the sex trade. In this whole process, one of the realization has been that the state actions have been delayed and they have faced mounting hardships. The whole transport that was there, it was totally disorganized, unplanned, and the whole exodus of the migrants landed into a breach of trust for the migrants, made the whole mockery of social distancing now, and created uncertainty for their present as well as for their future. It took almost 36 days after the lockout for the Ministry of Home Affairs to issue a notification to facilitate the movement of the displaced workers back to their homes and subject to medical examination. Here it's very important to note that when people had to move by air, they did not require many of these requirements that the migrants were made to go through. The train services that were given to them was happened only after a court intervention, and that's why it took 36 weeks. States of the center did not make the proactive action, and there was this whole thing of online booking of seats, which means that we assume that migrants have a smartphone in their hands. They know how to use the smartphone. And even after registering on the smartphone, they were not registered. And they didn't know whom to go out to, because there were requirements of getting a medical certificate. Now, the medical certificate was supposed to be given by a hospital, but it needed a clearance from the police. So the migrants were actually thrown between the police and the health system. And both of them would not give them actually reasons and answers of how to go about, nor was the online facility working. Once I reached home, there was this unique thing of being sanitized with a certain spray that was used. They had to be quarantined, and many of them were unwelcome in their own houses. The courts, as I told you, were totally blinded when it came to the migrants. A lot of rule orders were being passed, but when it came to the migrants, it required intervention through the advocates who wrote a letter to the court to work on behalf of the migrants. They were denied the claim that migrants should be paid for the interim period where they had lost their labor. The court made this really weird statement. If they are provided meals, then why do they need money for meals? It's not just the meals that the migrants require. They require to send money home. They require for their small other expenses. They require money for travel. And the courts were not sensitive to these needs. When the trains were started, 40 of the trains, is said, did not reach their destination. And when they had to reach their destination, they took very long hours. Some travels which would have taken some 28 to 48 hours took almost 5 working days. And in that process, because they did not have food on the train, they did not have water in some of the trains. This is not to all, but a lot of the trains had these problems. And there were people who died. There's something between 25 to 40 people who died on the trains. The courts observed all this as silent spectators. They did not even respond when the sanitization was made by the administration, when people were not allowed in their homes, nor when the people died on the trains. Even today, while a lot of people have moved back home, there are still some unorganized labor, such as the bonded laborers, who were not allowed to really walk out of their spaces. And it really required rescue to bring them out, because they didn't have money, they didn't have food, but they were left in bondage. What I want to say in this slide is that all migrants are not the same. There are different categories of migrants. Some of them might be permanent. Some of them might be seasonal, who come for a temporary period and then go back to their homes. And there are these footloose migrants who move from place to place and do not have a final destination. A few of the migrants land up as vendors and shopkeepers. As I told you, the migrants, while we say 40 million are working, the figures of migrants in India is around 454 million internal migrants. Most of them, a third of them are for interstate and inter-district. 50% of them work in the formal sector out of the 93% who are in informal sector. It means that only 7% are in formal sector. The migrants have an act, Interstate Migrant Workmen Regulation of Employment and Conditions of Service Act. However, this act has never taken shape. It would have protected the migrants in areas where people came from five or more states. However, this act has never taken shape or has seen the light of the day. And people, neither is the administration nor the employer really concerned about getting people under this act. And we must remember that this act also has limitations because it looks at only areas where there are people coming in from more than 5 states. There is also a Contract Labor Regulation and Abolition Act. This registration also has not taken really good shape because it requires registration of the employers and the people who are employed under him. So any contractor having more than 20 people need to be registered. This also has not taken forward. In the recent times, we have around 250 labor acts in the country. As a step to get all these labor acts together, the central government in 2019 developed the Occupational Safety, Health and Working Condition Code 2019. It brought together 13 prevailing labor acts and helped to plan to regulate health and safety of workers in establishment where there are more than 10 or more people working. This is still in the standing committee while 3 of the codes have been approved. The safety code is still pending, and so it will take some time to really take shape and take off. There are other acts like the Street Vendors Act and many others, but in this, for the migrants, I think these are the 4 major acts that are relevant. There's also a National Labour Commission, National Commission of Labour that is there, which is supposed to be looking at this. While this is there, and to some extent the labor codes do function under it. In 2002, there was another thing that came in, is the casualization of the labor and made labor a very flexible part. This happened with the globalization that we see. And this was felt that it was very required and it robbed a lot of benefits that the labor would have. There's also this National Commission on Enterprise and Organized Sectors. The employers were very unhappy because there was a lot of things in terms of how to address low wages, how to work on unequal bargaining power. The employers were happier depending on state level ordinances that were there. Alongside, we must remember that the labor force, the unorganized labor force, do not belong to the trade unions. And given that only 7% are in formal labor, the trade unions apply only to that 7%. And even in that 7%, 50% are not in organized labor. There's also this fund that is called the Construction Workers Welfare Board, which has a funding that is put in over the years, and it has huge amounts that is lying there, and only 21% of it is utilized. And this is when, in the recent times, this fund is made available for the migrants, and this happened about 15 days back. With the whole COVID-19 happening and the whole economy being in shambles, there was this call from UP, MP, Rajasthan and Assam to initiate a process of passing ordinances so that they could scrap the labor rights in regular works. You must remember, this does not apply to the, this applies to the formal sectors where we have 7% of our population of the migrant workers working there. The call was towards scrapping up of all existing labor laws, which means that they wouldn't get proper salaries. The minimum salaries would not be made available. They would not get their pension. They wouldn't get their protection. They wouldn't be able to ask for their safety. And worst of all, they wouldn't be able to unionize. So each state did different things. Like for Gujarat, it was 1,200 days. For Rajasthan, it was like abrogating the prevailing law. So each state did a little different. And worst of all, there was a call to change the working hours from 8 hours to 12 hours. And if by chance the laborer went above 12 hours, they wouldn't get the overtime money. Here the whole presumption was that we would be able to attract the industries which were leaving China, and we could improve our competitive capacity and also stretch working hours, make it very attractive for the people who would want to come into the country. But if you look at it globally, unless until you have strong labor laws, foreign donors will not come into the country. And so the assumption was not really founded well. As I told you, we did not have a count of the migrants who were there in the country. There's no database. And if you look at the data, we see that there is a inter-urban, like within the district movement that is rising. There are more people coming in for long-term migration rather than short-term migration. And within the state, migration is 4 times more than across states migration. So there's a need for comprehensive database of migrants. Possibly the suggestions have been that you start with the NREGA enrollment and move forward with the PMJDY, and also look at what are the remittances that are being made. There's also the database that is available with Ayushman Bharat, with PM Kisan, with PM IDY, PM UY and Mudra. So all these can be interrelated and you would be able to get some amount of database to start with. There's a whole discussion that is happening on one nation, one ration card. If you are able to, and the whole purpose is that the people can receive their benefits, ration benefits, anywhere in the country other than their PDS. So if you are able to do the portability of food security, then gradually we can bring in health care, educational care, and so on. Government recently announced that they will bring the migrants and the urban poor under PMJY so that you could bring in affordable renting, which is a very positive step in that direction. If you look at what is the policies that the migrants really require, we need to have a national policy on migrant labor. A shift which is very different from what the UP government said about migrant commission. We must remember that if you have an act and enact that act, it's much more powerful than a migrant commission. A commission does not have teeth, whereas an act has teeth and is able to, you can fight when a person does not get his benefits. We also need to halt the abolition of labor laws because that's the only protective mechanism that migrants have. We have the NREGAs where central government has released 40,000 crores. It would possibly generate 300 crores person days of work. But we must remember that this is a temporary solution. It can last only for 100 days if a person gets the full 100 days. We need much more long-term sustainable solution. And we hope that the government is able to look at it and do something more something correct. The fears now that is there is that 30% of the migrants may not return back to the cities because their last 2 months have been quite traumatic. This is something that Dr. Rajan, professor at the Center of Development Studies, Kerala, has been speaking about. One important thing that you need to look at is, should we call migrants as internally displaced persons? This guiding principles of internal displaced person is also called as Deng principle. It gives legal recognition for migrants and helps them to invoke rights under the international laws, factoring hardships due to involuntary movement. What are IDPs? When do we call people as IDPs? IDPs are persons or groups of persons who have been forced or obligated to flee or leave their homes or places of habitual residence, in particular, as a result or in order to avoid the effects of armed conflict, situations of generalized violence, violations of human rights, or natural or human-made disasters, which COVID actually fits in here. and who have not crossed any internationally recognized state border. If you look at the whole thing of COVID, what COVID has done, it has restricted movement of people across the borders, and hence you can actually call them as internally displaced people. India has not been very rejected this binding nature of this principle because of the absence of intergovernmental negotiation when the drafting of this guiding principle was being developed. But if you make migrants as IDPs, it will pave the way for spreading awareness, monitoring, data collection, and also adopting streamlining national strategies and plan of action. We would have, and it will also protect the migrants through international obligations that are ratified over time. Thank you.
Thank you, Dr. Rego. We will go to the next presentation. And Gayathri, may I request you to put that up, please? So the next presentation is on psychosocial costs of COVID. That will be presented by me. My name is Srilatha Juvva, and I work with the Center for Equity and Justice for Children and Families with the School of Social Work in the Tata Institute of Social Sciences. I come with an experience of having worked in the areas of mental health and disability and on disaster mental health. And I care about manifesting full potential and dignity in all people, including people with mental illness and disability. So the title of my presentation is going to be Social Costs of COVID. I will do the screen share in a bit. Gayathri, can you take off the screen share, please?
I have taken it off.
Okay, it's not showing. Maybe there's a lag. Here you go.
What is the problem, Srilatha?
I got it, no problem.
Okay.
All right. So what I'm going to do today is to talk about what are the psychosocial costs of COVID, and while I will talk about generally what happens to people, I will also focus on two groups that are one is are people with disabilities, including people living with mental illness. Before we go on to what are the psychosocial costs of COVID, let's look at some guiding principles that guide us through any pandemic situation or disaster situation. The first guiding principle is that whatever responses we have just now, which may seem a little unusual, are actually normal responses to an abnormal situation, because a pandemic is an abnormal situation. Okay. Everybody is affected by the pandemic. Nobody is untouched by it. And by and large, you will find the fear either of being infected or the fear of infecting others. Any pandemic or any disaster for that matter results in trauma, and the trauma is both an individual experience as well as a collective experience. An individual experience can be what is happening to you and me. A collective experience is what, as we saw Dr. Rego describe with the migrant groups. Yeah? Because we are living in a little unusual situation such as the lockdown and quarantine, they can cause daily living concerns in all of us. And that's okay because it's a pandemic situation. Nevertheless, the good news is that all people, including you and me, are capable of being and becoming self-reliant and resilient. Yeah. Another assumption that we make in this work is that all people, including you and me, have the ability to respond with concern and care. And it is an innate quality within us. Similarly, how much ever we think we are strong enough to deal with the pandemic, social support is essential for all. What are some of the common responses that we have to COVID in an individual? Okay, so one of the first things that we have is, am I going to die? Am I going to fall ill? Am I going to be infected? And therefore, should I avoid going out? Should I not touch doors? Should I not travel by elevators? Should I not go outside at all? Never mind that I'm not going outside because it's a rule that we have to follow. I'm not going out because I don't want to be infected. So that kind of a fear of being isolated and separated due to quarantine. Now that's a very genuine fear, because we've heard of WhatsApp messages doing the rounds where we hear children don't even know what's happened to their parents because they are quarantined in an isolation ward. And some parents have passed, but children are not aware about it. Families, or as parents or as adults, we feel powerless because we cannot protect our loved ones from being infected. There's an experience of being helpless, bored, loneliness, which I'm sure all of us experience at various points in time and at varying degrees of intensity. There are also experiences of stress, and for some, it's reliving a previous illness or a previous epidemic, whether it's a Nipah virus or the Surat plague or the SARS or whatever, or the swine flu. Yeah, and we're also scared to seek healthcare for any particular problem, because we don't want to go to a hospital where the risks of infection are very high. In addition to this, there is an increase in substance abuse and subsequent domestic violence. We know that the numbers have increased. The helplines have reported a significant increase in calls with regard to violence and abuse. Then there are also increased fights, anger, arguments, and aggression at home, and there's a reporting of these. There's deterioration of an already tenuous relationship where it's rather weak, and therefore, fights occur more frequently. In our panic and in our fear, we're very quick to forward or to consume information without even verifying whether it's correct or not. Or the other extreme, where there's a total mistrust of information, even if it is from the government. While these are only common responses, this is not an exhaustive list. I'm sure there are many more. What happens to families and people in the neighborhood? There's increased household work, and there's very little help. I mean, in Economic Times 2 days ago, we find that people who are working from home have double shifts to do, and some do triple shifts, with very little time to be able to contribute to household work or take care of children. And that really kills parents, because in the past, when parents could go to work, to the workplace, they would come back and slot sufficient time to spend with the family, and that's not possible right now. So everything becomes a task, whether it's cooking or whether it is cleaning, it becomes a task, and it can become a tutu-mai-mai issue at some point in time. Misinterpreting regular common symptoms like fever or a sore throat or a headache and relating it to COVID, and thus leading to panic. Routine activities are disrupted, so whether it's waking up time, whether it is circadian rhythm, whether it is household tasks, or whether it is putting off tasks, or whether it is office work. So this disruption of routine activities can cause a lot of discomfort in people, and this alteration of routines is a very clear stress-provoking factor. It's either a loss of job or a loss of steady income, or having to spend extra, because people working from home spend a lot more time on electricity and other amenities, or whether it is eating. So, the amount of expenditure increases, and for some, the income has decreased. And here I'm only referring to people who still have the luxury of having a job. For people without a job, you can very well guess what's happening to them. Rejection because I'm COVID positive. I mean, we've heard of stories after stories in housing societies where people have been discriminated, rejected, stigmatized because of being tested positive for COVID. Frontline workers and healthcare professionals being stigmatized because they work in COVID hospitals. And there's also a decrease in social network where we don't reach out, we don't do our routine activities, whether it's walking, whatever. So the entire decrease and shrinking of social networks and also having to be in the house all day can also be a source of stress. And that is still a common response. Um, with reference to two particular groups, people with disabilities in general and people with living with mental illness, the way they experience the COVID and the lockdown is going to be a little different from what others experience. One, because uh, being isolated or being locked down or locked in is not helpful for people, particularly with mental illness. It only makes them feel more uncomfortable. It enhances the fears. And that can lead to an increase in symptoms. Okay. It also leads to difficulties in accessing medication. I need to go to the doctor. I'm scared to go to the doctor. I need to, despite telemedicine guidelines and so on, accessing medication, and maybe if the doctor or the therapist was one source of comfort, even accessing that is limited. So that can cause stress. Accessing various kinds of therapies ranging from physical therapies to speech therapies or to psychotherapies face to face, and having to look at alternate modes of therapy can lead to a lot of adjustments that have to take place. Difficulties in accessing household supplies and daily consumption material, particularly for people with disability, because it means that having to go out and get in a lockdown time when they have to depend on others. In the absence of those who have personal assistance, in the absence of personal assistance, this can lead to a lot of limitations and a lot of threat to supposed security. Disruptions of schedules, particularly because the schedule that I had earlier, whether it was going out to the daycare center or engaging in certain recreation activities. I remember my nephews and nieces say, I don't have art supplies. What do you want me to do sitting at home all day? So that is not helpful, no? So disruption of schedules not only look at, work that they can do from home, but it also looks at diminishing supplies and therefore leading to discomfort and stress. For people with sensory disabilities particularly, is the information that is being provided accessible? That is, and particularly, these days when it's compulsory to wear masks, how can we expect a person with hearing impairment to lip read, especially those who are oral deaf, who can lip read and therefore understand what is being said? So making information accessible is very important, particularly for people who use Braille or who use Braille supported software, and for people with hearing impairment. How do we make information accessible and available? Again, this is not an exhaustive list. There are more and we will look at. Some of the principles that we need to keep in mind in caring for people with disabilities, all kinds of disabilities, are these. People are more important than the impairments, so it's extremely imperative that we respect the dignity of the person at all costs, despite the impairment, and foster his or her agency. That means I create an atmosphere where the person with disability can take certain decisions. Now, this is not an easy task. We've heard of reports in Calcutta and other places where parents have found it so difficult to take care of people with disabilities, especially because they don't get respite. And, earlier at least a child would go to a daycare center or a school, but now they have to deal with, work with a child or at home all day. And the burden of care is so severe because it requires different set of skill sets to work with them. The father beat up the child almost to death. So, or there is, there are suicides. So these are all issues that we need to keep in mind. And when we keep the dignity of the person at the forefront, we don't engage in harmful or activities that can sound very harsh. Disability is not a homogeneous category. Disability and impairments are heterogeneous and therefore cannot be typecasted. So therefore, we need to individualize the needs of the person with disability. Important to use the person's first language, that is, put the person before the impairment, rather than call the person blind, or rather than call the person, a langda. Can we say the person with locomotor impairment, a person with visual impairment? So put the person before the impairment. Okay. Some people with disabilities may need repeated explanations. So patience and talking respectfully is very, very important, and we need to keep that in mind, as it is with every human being. So it's not to discount us as being the so-called able-bodied as being extremely easy to get along with. It's not entirely true. People have a right to access to treatment and services, including people with disability. Therefore, we cannot leave anybody behind. That's imperative. How do we see, just as much as we talk of what are the difficulties that people face, the pandemic, COVID-19 has also helped us discover the inner strength within us. It has also created opportunities for us to foster resilience within us. So it has also enabled us to transcend resistance and be resilient. For some people, learning new skills. I have a neighbor who says, I didn't know I could cook and I'm quite enjoying it. In the past 2.5 months, I have not repeated a single dish. I said, wow, that's really impressive. So learning new skills and this gives meaning in life and purpose in life. So it is in our hands to look for that meaning and purpose, to be able to go beyond the pandemic and make our lives meaningful. So whether it is to engage in household chores or multitasking or spending time with family or dirtying your hands with, gardening, growing your own green leafy vegetables at home, such as methi, sarson, all of that, or whether it is, doing things that we can do with children. One of my niece likes to play ghar ghar or doctor, and while the mother gets very bored, that's the only way to keep the child engaged. Yeah. So these are things that we could engage in. How do we respond to the pandemic? One of my friend's mother makes masks and supplies chai to the chowkidars of the society as well as the police. Never mind that my friend has more work to do, but that's okay. Look at the meaning that an 80-year-old can create. And if an 80-year-old can do it, anyone below 80 can do it, or even above 80 can do it. So, it's all in the mind. We either have results or reasons, So we can help in relief work, volunteer, look out for vulnerable groups and provide care for them. One of the best ways to do this is to verify information, procure accurate information, and share it. How can we connect during containment, particularly to loved ones, particularly to people you think who are staying single, alone, and reach out to them through various, media, whether it's social media or whether it's, telephone and so on and so forth, and provide care and support to those in need. So these are some of the psychosocial aspects related to COVID-19. We'll now move on to children and see what children experience with regard to COVID-19. Yeah. So Gayathri will be our next presenter. Ms. Gayathri KR has completed her MPhil in Psychiatric Social Work from NIMHANS in 2006. She has worked as a researcher for 4 years at the Child and Adolescent Psychiatry Center of NIMHANS, as a case manager for over a year in the Employee Assistance Program of PPC Worldwide for 2 years, has worked for a year with the Center for Culture and Society at Bangalore, and has joined Muskaan, a field action project of the Tata Institute of Social Sciences since 2013. Currently, she works as a senior psychiatric social worker at Muskaan and also a doctoral scholar with the School of Social Work at CITIS. As a senior psychiatric social worker, she engages in different settings of Muskaan, which includes the clinic, family court, schools, and communities. Her areas of research interest include children and adolescent well-being from a lens of attachment, trauma, and intersectionalities. She cares deeply about manifesting awareness and resilience in people and works towards that through her work. Over to you, Gayathri.
Thank you, Dr. Juvva. And it was really, insightful for me too to hear to Dr. Rego and you. And a lot of it actually, flows into, when I discuss about children. Oh, sorry, just share. Just give me a minute. Not getting the right one. Just a
You
minute.
have to go to the bottom of the page and see the green symbol saying share screen.
Yeah,
You
I
can,
got it,
yes, ma'am.
but my other PowerPoint is getting. Let me do one last time. Otherwise, I'll just close it.
Ma'am, it might show the tabs that you want to share. You
Okay.
can select the tab accordingly as to
Yeah,
which
yeah,
is
sure,
the
do that.
presentation that you want to share.
It's happening. Still not. It's not happening.
It's on the
Just a
same.
minute.
Could you see the options of the presentation which you want to share,
There's
ma'am?
some issue. I'm not able to share my screen. Where am I?
Yeah.
Okay, what's happened? Yeah. So the topic of my uh, given to me was on psychosocial impact of COVID-19 on children. So, uh, you know, like all of us, a lot of changes, rapid changes have happened uh, to children, and these changes are happening both in their physical environment and to their emotional environment. So, the obvious of the physical environmental changes that we know is one, that of the breakdown in routines or changes, large changes in their routines in terms of school closure, lockdown has brought out a sudden end to the normal schooling, wherein in the initial phase it was very exciting, but now suddenly children are getting to feel the loss. So closure has happened in other childcare centers such as daycares, Anganwadi centers, and the new norm of physical distancing and to getting to adjusted to home confinements. And to an added layer of it is where children also who, children from families where there are members who are, infected with COVID, or children of frontline workers, so they really worry about their safety. And physical and emotional safety of children is really at stake, and it is also being reported in a huge way. And children also have been, taken away. The basic needs of children are taken away, and there is a lot of lingering uncertainty to their future. So, having said what, when there is a change, such a change in the physical environment, what happens to the emotional environment? Uh, we know that children go through a lot of psychological distress. So when there are fears, anger, which probably is a way of adjusting to this new normal that they have, but if it's persistent, if there is something that they are unable to manage, then it's a point of concern. So children are experiencing possibly a lack of predictability, a loss of emotional security, a sense of security in their everyday lives. So so a lot of times we think, okay, young children, even infants, even toddlers, they make sense of their world by observing or making sense of what their parents are feeling and how they're relating to them. So children exist in relational experiences. So given the situation, a migrant worker who's a parent who has a child, we are hearing stories of what's happening to children. So such extraordinary situations where parents or caregivers are unavailable physically, they are also unavailable emotionally to children. So that has probably, it's leading to some kind of a deprivation, which is not really visible to all of us. And so what is this deprivation? This deprivation has to do with uh, you know unaddressed emotions. When there is fear, fear is often silenced, anger is often told why are you angry, or it's punished. So or there is a gross disregard for it. So when children are not heard, or they don't understand what's going on with them, they tend to experience something called as an imbalance of emotions. We call it as emotional dysregulation, and that is critical for children who have a developing brain. Is critical to their brain developing of various regions of the faculties, high faculties of the brain, and therefore it has implications for their long-term outcomes in their lifespan. um, so a lot of reactions which we may have heard of, um, children being new changes, such as being more irritable, more clingy, having a need for extra attention, disturbances in sleep and appetite, or eating more, eating less, or um, uh, any other challenging behaviors of aggression. So it's there needs to be an effort from adult caregivers to have an extra amount of patience, an extra amount of or different way of listening and making conversations to them. But is it really possible in this situation? So a quick look at what is it this uh, what is an emotional dysregulation, and to be able to understand that, the hand brain model, which was a very significant and a simple way of understanding human brain. So when we fold our hands, this happens to be our brain stem. This is an analogy of our brain stem, and in the middle is the seat of emotions or limbic region. So moment the brain senses some extraordinary stress happening, the brain stem collects the information in a certain way and passes it to our emotional region to make meaning out of it. So suppose the emotions are extraordinary, of such as fight, which is like you are so disturbed and you're angry about it, or if you feel suddenly the information is overwhelming and I can't handle it, it's a freeze, then the higher regions of the brain flips, meaning you can't make sense of it, and you're constantly not able to plan, learn, think in a way we normally can. For children, it has more implications because it allows their, if a brain is seated like this, is when we are following what's happening around us. We are able to make sense, we are whole, we are calm, we are learning. So this is a way we ideally do when we are in action. But when we are flipped, mostly in this kind of extraordinary everyday situation, when emotions are not in place, this is how our brain is more or less functioning. So when there are multiple stresses, so what I was firstly discussing was something called as in a relational experience, when a parent is emotionally connecting, available, in the most appropriate. Not that all times the parent needs to be there, but some appropriate time when the child needs, when the parent is able to address the emotional needs of the child. So that such connecting times are available to children is critical to their well-being. So a lot of times, because of adverse life circumstances, children experience something called as adverse childhood experiences. This has been a very huge study which has found that when there are multiple challenges, so here we are talking about children who experience abuse, physical, emotional, sexual abuse, and neglect is another huge area where children probably. So, in such deprivation of neglect or experiences of domestic violence, where there are parents who use substances, where there is a parental mental health issue, or there are other kinds of conflicts in the family despite pre-existing issues. So when there are multiple life experiences, more than 4 adverse childhood experiences can predict a certain trajectory in your lifespan with more or less not a good outcome. So probably this is a concern that we must look into. So we are also talking about quarantine and home confinement. So home confinement, it's already discussed earlier. So uh, here this is a situation where front parents of children of frontline workers, or children who have to get themselves quarantined, or parents who have been quarantined, and the time and the certainty of parents coming back, meeting, going away is not clear. All that can have very invisible way of deprivation. School closure and lockdown, it's clear school is a home away from home with multiple connections. Teachers are a form of connect, and there might be unfinished, unattended things that has been left in the school, and then there are so many things that might be happening. So then there is a lack of, there's a lot of restriction in the environment in terms of which causes a loss of control in their own self. So some homes having not enough space for doing the things they wish to do. So one doesn't really know, is yet to get clarity into how and to what extent this kind of experience can lead to what kind of an outcome. Loss of structure is critical, because then you suddenly you find a child finding it hard to do any physical activity, doesn't know what role to do at home. There is lack of there are sleep issues, there are diet issues, children who are not even having basic needs. There's an issue of a whole new way. And increased screen time is another major issue that is seen in children. Children who spend excessive screen time are bound to have unique issues in terms of fatigue and lethargy and concentration difficulties. So what happens to children who are from already from low income families, have been depending on a lot of public supported programs? So they do not have a stable house, basic amenities, so they have an added burden of deprivation. So the learning gaps and the very notion of equity and right to education is falls flat. um, Child abuse is also very it's a high you know the instances of reporting high child sexual abuse has also been higher. um, Children can drop out from formal education, and they themselves can get into high risk behaviors in this context. When I have attended a number of sessions where in ARPA, done by Childline and ARPAN, they have reported that um, the highest hit on a search engine is that of child porn, and Chennai being the major region where the maximum number of hit on a search engine has been that of child porn. So we can imagine what are we you know getting into. So children are both direct and have passive exposure to all kinds of psychological aggression and physical punishment, and that can leave injuries and which do not have any possibility of repair uh, at the moment. And also the fact that children may have access to uncensored, excessive online would also have a high risk to cybercrime. Um, Already Dr. Rego has explained about what happens to migrant workers. So the voices of children is never ever known to us. So we need to really probably really see more and see what we can do about that. And children with special needs, um, the for children with disability, children with developmental care needs, they experience a sudden interruption in their the developmental trajectory. I mean, their developmental needs are suddenly come to a halt. So children needing supplies of medication, children with diabetes, children with HIV, children with other chronic mental health needs. I know of a child who's not being able to source medications. So these are basic needs that are not getting, and of course, which is together with lack of other mental health care needs. Um, of course, I've touched upon what are the issues of children of frontline workers. Um, Not just not having parents around and not just the loss of attachment, they also probably experience a lot of fear and grief about, what will happen to my parents? Will something go wrong? And that is sort of uncertain, quote unquote. And children who have lost their homes and suddenly all of a sudden, and displaced children, children who have high risk for big T trauma of abuse, all of them have already at risk of major mental health challenges. Also, I found that pre-COVID, of course, child labor is at such a high, and post-COVID, when family members who adult caregivers are not able to support them, what will happen to child labor, we can imagine. So, notwithstanding said, the impact of a pandemic can have a lot of long-standing social, economic, and psychological consequences of children, and therefore we need to really look into it. In some children, like some studies have reported that children are experiencing specific issues, specific mental health problems such as this. You know, uh, Sleeping difficulties, nightmares are being reported. Children are becoming more emotionally, withdrawn or aggressive. There are more complaints of stress like aches and pains. They fear of being abandoned by their parents or being left alone. They have a lot of around it clinging or depending behaviors are being manifested. Not having to go out and play and being restricted to their homes without a natural expression of their energy, it in itself is like a gross understimulation of their own self. So it it does have some kind of implication. Some children who are able to channelize their time and invest time in creative work are able to sufficiently move through this confinement, challenges of this confinement. Um, However, there are situations where parents are not able to handle the emotional difficulties faced by children. In such situations, now there are more and more advisories, and even UNICEF has recommended online platforms for therapeutic support for children. And again, it has been reinforced very clearly that the primary factor in children for recovering from or adjusting to a trauma situation is the presence of a supportive and caring adult in the child's life. So it's okay even if an immediate parent is unavailable. Children can be greatly supported by at least one adult in their life, who can be consistent and be sensitive to make sense of their world. Children have the capacity to be resilient, to turn into their self and regulate themselves, yet they exist in a relational space. uh, a lot of children do experience fear of stigmas, fear of being rejected, abandoned. In such children, um, there is a they can turn more into themselves and have they stop believing in the world and the society. So there are uh, such challenges as well. So So how do we look at and probably what could be one of the way forward? Ghosh et al. Has suggested, I felt it was a little useful to reflect on this, that if basic needs of children are taken care and there is the continuation of child's educational needs in whatever manner possible, online. Many schools who and children and families who can afford have shifted to online, um, and also look at other, have effective policies for, say, how can we put an end to child porn, homes can be protected, sorry, can be can be avoided, so having taken and that can be a way. Thank you. In fact, Arpan and UNICEF has come forward. Arpan has, in fact, I can just show you guidance as well as for children in terms of how to ensure personal safety. In what way one can, while being online, what are the ways to remain safe? And it has been made and co-created by adolescents themselves, and it's available on their platform. There are several other interesting manuals which you can make use of.
Thank you, Gayathri.
Yes.
All right, you're going to project the next one, right? Okay.
Yes.
So now we'll move on to the next presentation. Our next speaker on the panel will be Dr. Ruchi Sinha. Dr. Ruchi Sinha is the chairperson, the Center for Criminology and Justice, the Tata Institute of Social Sciences, Mumbai. She has completed her pre-doctoral and doctoral degree from Jawaharlal Nehru University. She has work experience on issues related to criminal justice system, policing, cybercrime, social work in the criminal justice system, criminal justice policy, violence, human rights, etc. She has been a core faculty member in the area of policing and the Criminal Justice Fellowship Program, and one of the steering committees of the Prime Minister's Rural Development Fellows Scheme, which is a government Ministry of Rural Development and Government of India with state governments. She's also held various positions in national and state level committees in academic institutions, as well as the planning commission subgroups. She's recently involved in a national research study on human trafficking in India, supported by the Ministry of WCD, NHRC, NCW, UNODC, UN Women, and the Tata Trust. She's concluded state consultations on prevention of sale and sexual exploitation of children, strengthening justice mechanisms in Maharashtra, and consultations with all stakeholders. She has many publications in books and refereed journals. So over to you, Dr. Sinha.
Thank you, and thank you for that slide, Gayatri. I think it kind of...
Sorry, the slide just
No, it's okay.
didn't work
It's
for me.
nice, and it talks about, core values and ethical values that we all stand for. And I think it's just on the right note for the police that I'm going to be talking about. And before I start talking, I would like to tell all the participants that being the last speaker is both good and bad. Good because you guys are not going to be attentive enough to ask me pointed questions, and bad because maybe I can't kind of tickle your imagination on a topic which I think we all should be quite vigilant about. Okay, but anyways, I'll try my best to be short and sweet, and I hope um, you get to appreciate that the police also needs to be looked at, understood during this whole pandemic of COVID. Okay, and the reason why I'm very happy to be talking about this is that police normally has never come into the forefront of any debate when we have talked about the pandemic, whereas when we talk about institutionalizing mechanisms, police has always been there. So this dichotomy has been very, very frustrating for me, because you want them and yet you don't want them, and that is a very difficult profession to be in. So I've got talked. I'll be talking about the police perspective, and please feel free to ask me questions in between of the presentation as well. Just to kind of refresh our memories, that the timelines of this lockdown started from the March 25th and continues. So it's actually, we're talking about 3 months of complete uncertainty, which has hit just about anyone and everyone. Dr. Anita Rego talked about migrants. Dr. Juvva talked about mental health. Dr. Gayathri talked about children. And unfortunately, we forget to talk about the police, because police are human beings as well. They have also been hit by the uncertainty, and they've also been hit with the uncertainty of the response that is expected out of them. So essentially what I'm going to try to do is, I'm going to say that why do we need to understand the police angle, what has been their role, and how can you and me contribute in maintaining law and order and ensuring that the police remains responsive, and we do not get to either bear the costs of police atrocities, or the police does not bear the cost of social disorganization. We have to be mindful of both. So if you see the law enforcement, and law enforcement I'm using very consciously, because when we talk about the police, I'm also hoping to include in my presentation today the CRPF, the Assam Rifles, the BSF. They are just all been caught into this whole desire to protect the nation from the pandemic without being told what do they have to do. Every time they ask questions, they're told that they're essential employees. They do not have the benefit, like at least we have, to work from home. There is no work from home option for them. They cannot do teleworking, and they are constantly being told that crimes are reducing, because आखिर crime हो कैसे सकते हैं जब लोग घर पे हैं. But what they forget is that while certain amount of crimes are reducing, there are certain amount of crimes and problems that are increasing, which Dr. Gayatri and Dr. Juvva have talked about, and that is domestic violence, child abuse, abuse of all kinds, even elder abuse. They all are increasing. And the sad part is that it has become even more difficult to deal with, because the victims are forced to stay at home because of quarantine and isolation requirements. So essentially, you become a victim of crime because you have to support a state mandate of staying at home. And in this context, when the police is contacted, they really have no options, because they cannot take out the victim from the home and put them in a social home or a state home, because the state home has got no capacity to deal with social distancing, social isolation, or quarantine. So it's really a double bind for the police. What they are also sensing is that hate crimes and discrimination are increasing. As a nation, we did see that when the Tablighi Jamaat episode happened, it just kind of polarized the whole country, and it blinded the country to certain realities that all sections of society, all levels of society were engaging in. So this ability of the nation to kind of center their uncertainty on a certain community led to discrimination, and that discrimination, when translated in a state response, became all the more unbearable. However, thankfully, there is a certain back movement. People have realized that it is not only their mistake, there are others also who have contributed towards it, and Now we seem to be in a situation where we are saying that whom do we blame and whom we don't blame. And if all of you have noticed, you have been getting a whole lot of WhatsApp messages. And one WhatsApp message that really caught my eye was that the passport holders ki mistake is being the brunt is being borne by the ration holders, which basically says that the crime of the problems of the rich, the brunt is borne by the poor, and that is what Dr. Rego very well elucidated in her problems in the presentation when she talked about the migrants. Now, when we talk about the current crisis, at the first glance, one feels that, oh, what will the police do? And after all, the police does not understand or did not understand in the beginning that how does this infection spread? And hence, when they were told in the beginning, complete lockdown, curfew, the only option that they had was, if I see anyone, danda maru. Now, the danda maru technically, ethically was wrong. But if you look at the expression of policing where they said that we have to enforce this, it goes well with traditional policing. So the apparent paradox has been that the practices of traditional policing, which people were, or the police was indulging in, actually started endangering public safety. So why do we need to see the police angle? We need to look at the police angle primarily because there are two sides of the coin. So if the police is to blame, the police is also to be thanked. And if we don't do that, we will be, like you see that small little gift that is there, we will constantly be throwing water out of a boat which always has a hole in it. And we have to plug that hole, and we don't have to constantly reinvent the wheel. So the law enforcement agencies across India are faced with this extraordinary situation, and the agencies have to suddenly prepare themselves to become public service agencies in a civil arena instead of a criminal justice arena. Now, the shift that we were expecting from the police was to be done overnight. So when the lockdown was announced, the police was called and they were said, we have to see that nobody is on the streets. Now, the police was not explained what does nobody on the streets mean. And therefore, the usual perception of policing, which is always related to law and order maintenance, it was left to the police to reimagine what their role in this humanitarian crisis would be. And what has the police been doing in this lockdown? I'm sure most of you have been seeing these images. So wherever you go, even if you step out of your houses or if you look out of your windows of the houses, you will see that the police patrolling is there 24/7. And the sad part is that even if they're trying to enforce the lockdown, the citizen behavior towards the police has not been up to the mark. They have not been responsible in taking ownership of maintaining social distance. What has the police been doing? They've been verifying travel history. When the police has been verifying travel history, there has been no acknowledgement, but if they haven't, there has definitely been a lot of media attention. They have been coordinating medical teams, they're arranging vehicles, they are arranging food and supplies in hotspot areas as well. They are guarding the medical staff. The essential commodities and the transfer of essential commodities is also under their care, and of course enforcing social distancing norms. And normally, when we talk about the forefront battle or the front workers, we thankfully do manage to acknowledge the doctors, the nurses, the health workers, the Anganwadi workers, at times even the sanitary workers, at times the banking officials, the shopkeepers. Police fails to get that acknowledgement. And the sad part is that if anything goes wrong, it is the police that is called, and yet they're always missing despite the fact that there are myriad responsibilities that they undertake. Okay, so again, I would say you must have seen a whole lot of media coverage. So recently, I think just yesterday, there was this whole video that went viral, where Mumbai police was running to help a whole batch of migrant workers from Calcutta to be able to board the train, the last Shramik train that was leaving the station. And then obviously around a month and a half back, when a police official in Punjab lost his hand because he was attacked. Now, when we look at these two visuals, vis-a-vis the visuals where there has been police atrocities, it leads us to question that where and how have we gone wrong? What can we do, and can it be addressed? How can it be addressed, and do we want to address? These are the questions that most of us are often dealing with. Now, the point to be noted here is that you can definitely question the practice of policing, but you cannot question the law. And the reason why I say that is that the law that has been enforced right now in the country with certain state specificities does give a whole lot of power to state authorities. Yes, the state authorities have to be mindful, they have to be very, very humanitarian in their response, but that also desires and also uh, is dependent upon if the citizens are going to be acknowledging their duties in maintaining law and order. So this is a small little snapshot of what have we been experiencing. Most of us who've been sitting inside the house probably do not know the nuances of the curfew, section 144, lockdown, where does it come from? Can the police do this? Can't the police do this? And most of the times when we've been in the police station, we've heard many people ask the questions, कि आप ये कर कैसे सकते हो? Who gives you the right to do that? Now you can't ask the policeman who gives you the right to do that. You can definitely ask the policeman, ये आप किस section के अंदर हमारे ऊपर ये enforce कर रहे हो? So it's very important for us, if you look at this snapshot, that you need to understand what is curfew, what is section 144, and what is lockdown. Where do they come from? Do they come from the IPC? Do they come from the CRPC? Or does it come from a particular act which has been promulgated to deal with this pandemic? And when you deal with a certain law, it is very important for us to see what are the restrictions that have been imposed upon, what are the exemptions, passes. In fact, I'm sure most of you have heard the police is rejecting passes by the dozens. The police has been given the right to decide what is essential and what is not essential. What happens during that violations? Where is the legal backing? Is the legal backing with the police? Is the legal backing with the court? Is the legal backing with the district magistrate? It's very important for you to understand that. And is it going to be promulgated for essential services or not? That is also mentioned in all these acts. Along with these, we have the, EDA is the Epidemic Disease Act. And while there is a central act, there are also state acts which have taken on board. And in fact, of late, the best that they say is of the that one normally quotes is the Kerala Epidemic Disease Ordinance 2020 Act. And that ordinance is very good because it's got together the criminal, the civil, and the medical requirements of all different acts together, and it has empowered the civil and the criminal administration to come together and act to ensure that social isolation is imposed and followed. Along with this, you have to be very, very mindful that section 269, section 270, section 353, section 271 of the IPC are in order, which specifically state that if a person endangers community health by spreading dangerous diseases, if a person does not listen to a public servant, if a person endangers a public servant, and if you don't follow quarantine, what can be done? All these sections talk about it, and you can be dealt with by the rule of law. Along with this, obviously, most states have followed the Disaster Management Act, which in its chapter 10 talks about, it prescribes offenses and penalties, and the penalties very clearly say that the police is the ultimate authority to be able to take action against a person who does not follow the rule of law. In between, I remember there were a whole lot of debates in the academic circles. What does social isolation mean? What does quarantine mean? And it's interesting that we have the Indian Aircraft Public Health Rules and the Port Health Rules of 2015, which talk about isolation and they talk about quarantine. So what we have to understand is that the enormity of this pandemic is definitely a huge one. But pandemics and epidemics have hit different parts of the country at different points of time. And we have used all these legislations, all these rules during AIDS, during swine flu, and bird flu. It's just that it did not become unmanageable and it did not spread because of the unique spreading capacity of this particular infection. So, this is an overview of the various laws and regulations that are there. So if you ask the police that how are you doing this, they might get irritated. But if you just ask them that under which law are you processing me or are you questioning me, the police will definitely respond to you. Okay, and the reason why I'm talking about all these is that if we do not work with the police, it's going to be a very unhealthy situation. But if we do work with the police, like in this pie chart, we'll all emerge as winners. And it is about emerging as winners, not as individuals, but as a country where we should be able to defeat the pandemic with the least amount of cost to the poorest of the poor, the vulnerable, and the marginalized. Okay, so there is a small attempt to get everything that I'm talking about in the small little easy reckoner, which we've called Policing in a Pandemic. It's there on the website of TISS. So if anyone wants to see it, they can just download. Everything is there. And in fact, my slide set is mostly from this easy reckoner that we have put together. Now, why are we talking about the police and what can we do? We're talking about the police because if we don't work with the police, it's going to be a heavy burden. Like you can see that heavy iron ball that this poor little man is trying to push, person, not man. And if we work together, we will slowly and steadily go across each and every little difficulties that this disease is putting us across. So the choice is with us, with all of us who are here, that whether we want to get doused, as Dr. Juvva said in her presentation, do we get disturbed or do we move towards the fact saying that, yes, I can do something about it? And the police also falls in this section, because there are some policemen who are saying, what the hell can we do? And there are certain policemen who are saying, come what may, I'm sure I can make a difference. And that itself has made a difference in the policing outputs that we see on the street. Can there be something that can be done with the police? Yes, there's a lot we can do, but immediately what we need to do is that we have to understand that the police will not respond to you in the traditional policing style. We've got a lot of phone calls where for domestic violence victims, for child abuse victims, where the police has turned around and said, "Aap hame solution batao, hum aapko facilitate karenge." Instead of saying that we will call them to the police station and then we will send them somewhere safe, because there is nowhere safe to send them. So there are, finally, what we've seen is that people have come up with alternatives. There have been gurudwaras, there have been churches, there have been missionary homes, there have been even temples that have opened up their doors to temporarily house these victims so that they are safeguarded from immediate physical violence. And once that has been taken care of, the police has swung into action into filing FIR, despite the fact that they're doing additional duty of patrolling the streets, ensuring that citizens like you and me stay indoors. And believe me, if we stay indoors, we can ensure that we can give better services and better outreach to victims of violence. In policy and practice, it's very important. And here I am very emphatically saying that policy and practice is not only about the police machinery, it is also about the civil administration machinery, which needs to understand that police cannot be given only directions. Police has to be taken on board to take joint decisions to be able to roll out safety mechanisms for everyone. And ultimately, the last measure to send out public education has been police. And I don't know how many of you remember, if you're from Bombay, that at the end of March and beginning of April, there were police patrolling. And this I have heard from Nagpur, Nanded, Amravati, everywhere, that on loudspeakers, they were constantly sending out messages that please stay indoors. If you need something, please tell us. But then our own mindset कि police को हम कैसे बताएं अपनी problem had stopped a lot of people from reaching out. But there have been stories where when someone has passed away. There's no one who could perform the last rites. The police has gone and shouldered the last rites responsibilities of the elderly. There has been, a sudden heart situation where they needed immediate hospitalization. The police has responded and taken the patient. They told the family members, "You stay at home, we will," and they've stayed in touch with the family members, and they have managed to save a few critical lives. So it's not that they haven't responded, but they don't know how to respond. And when they feel that yes, they can do something, they have been able to do it. However, some of them have slipped also, and they have indulged in certain situations and behaviors which they should not. And finally, the last point, that they need to be reassigned from normal policing duties in the police station to probably the BMC, the municipal corporations, to medical facilities. Because strangely, if those who work with the police will understand that we have police officers right from the constable level to the senior inspector level who have who have PhDs, double MAs. They are they have done their MAs in psychology, they have done their MAs in sociology. So it's not that they are as bad or as uneducated or as insensitive as they were traditionally around 15 years back. The ethos of police personnel has changed, but we've not been able to translate the ethos of police personnel into policing. And that is something that we really, really need to emphasize upon. So these are the short-term measures that we can do immediately. And what we need to do now is the long-term measure is something that I hope in some time.
Dr. Sinha,
Yes,
Dr. Sinha, we have majorly overshot the time.
I'm
So,
finishing. This is my
yeah,
last slide.
okay. So, yeah,
Okay,
if you
so
can just
the
do that.
last thing is that we have to reimagine policing, and we have to ensure that this context of uncertainty has impacted the the policing response, but the police has been able to somewhere realign its roles and responsibilities and is burdening a wide range of expectations. This all points towards the fact that policing needs a new paradigm. And once this pandemic is over, we have to get together, work together, and to be able to get the best out of the police, we have to be responsible citizens and assess the state, and not only the government can respond to the situation. I end with this.
Thank you.
Dr. Juvva, you are mute.
I now hand over the session to Professor Parikh. So would you like to take over, Professor Parikh?
Yes, yeah, sure. Uh, Dr. Juvva, I want to thank you for this very educative experience that you gave us, because we have been hearing about migrant laborers, but the kind of things that Dr. Rego told us about, that was in-depth information that we had no access to. And the other three of you, what you talked about is something nowhere in the media is talked about. So this is for the first time we got some kind of a information, some kind of insight into what is actually happening inside the homes, and what are the things that we should be actually concerned about, what we can do about it. Also, it wasn't just problem setting. You actually told us what could be the solutions also. So that was very educative for us, especially people who do not have background of social work. This was very informative. So thank you very much for taking time out, all of you, and enlightening us on all these topics. And now, Shubham, I think we have time only for one question. And the other questions, I guess we can just ask the people to send to the email addresses of the speakers, because the speakers' addresses would be available on TISS. So it should not be very difficult for them to find those addresses. So can you just ask one question, Shubham, and then we'll wrap up.
Sure, ma'am. Uh, this just a minute, ma'am. I'll just.
How many questions do you have, Shubham?
We have quite a few questions, ma'am.
You have quite a few questions. That's what I thought, because there are
For
so
all
many
four,
things
yes,
covered.
all four guests, ma'am.
Yeah. I'm sure because there are so many things which were covered in this.
Yes.
So, but yeah, I guess you just ask one question,
Yes, ma'am. I'll just take
and
the
I
first
think we'll
question,
have to
which
stop.
is there in the chat box.
Yeah, sure. Do that. Do that.
This question is for Srilatha, ma'am. It's a question from
We
Misbah
can't
Adik.
hear you, Shubham. We can't hear you.
Am I audible, ma'am?
Yes, this is better. Thank you.
Yes, ma'am. Uh, this question is for Srilatha, ma'am, from Misbah Adhikari. She is a student of applied psychology. Her question is, what about the guardians of special kids or mentally unstable people? In this time of a pandemic, they are under constant pressure and due to the problems that their kids are creating. How are they supposed to maintain their peace of mind?
Yeah, I mean, you're absolutely right. And that's why we've had instances of where people have lost it, particularly caregivers have lost it. And this is quite a burden for caregivers. Much as we would like to say that, they have to do it, it's very, very hard. It's all right for us to say, unko karna hi padega, kya kare? One of the things that we do is what we tell parents particularly is, can you take some time for yourself? Take some time out for yourself, renew yourself, recharge yourself. Can someone else in the family share the responsibility of caregiving? Can someone help with, let's say, teaching household chores? While there is no one size fits all answer, each parent or each family is encouraged to find its own mechanism. And the good news is that there are many online counseling services that are being provided, and these counseling services actually take the parents through a tailor-making individualized coping mechanisms. And one of the beauties is to be able to tap into the resilience of people. So I wouldn't want to say it is, while it is difficult, it's not like dawn, no, mushkil bhi hai aur namumkin bhi hai. Mushkil hai, lekin mumkin bhi hai. So we just need to find the right way out. Yeah.
Right, ma'am.
Thank you.
Alka, ma'am.
And thank you for your interest in this. I'm really touched.
Alka, ma'am.
Okay, so yes, so I guess unfortunately we'll have to close the session because, as I said, it's more time than what we thought we would be able to give. And but I think that it would be nice if the panelists just tell their email address here itself, so that the people who had questions can write to them directly without looking for it. So, Dr. Srilatha, can we start with you? And can you please tell your email address to the
I'm
participants?
typing it on the chat box. It is juvas@tiss.edu. Ruchi is ruchi@tiss.edu. And Gayatri, what's yours?
I'll just type it, Gayatri.r.
Yes, ma'am. I'll just do one thing. I'll just make all the email address public because I have received some of them privately. Ruchi ma'am has put out her email address for everyone.
Oh, okay.
Yes.
Yeah.
Gayatri ma'am, can you just
I have,
adjust the setting? Put you can set the setting as everyone to
all
send
right,
the message to
So
everyone.
all right.
sorry, I didn't notice that.
Yeah,
No,
yeah,
no
yeah.
issues, ma'am. No issues, ma'am.
Yeah. I got it for Dr. Three email addresses here on the chat.
Yes, ma'am.
And Gayatri is typing.
Just a second.
Uh,
Yes.
While we are typing out our emails, I'd like to read a quote for all of us to end the
May
day
I
with.
screen
So
share it?
I'll
May
put,
I?
yeah, but let's check with Dr. Parekh.
Yeah.
Are you okay with that, Dr. Parekh?
The code that you want to put up?
Yes.
Yes. Sure.
Yeah. Okay. So the last quote that we will talk about, Gayatri.
Yeah. Can you not see it?
It's visible,
Yes,
ma'am.
we can see it.
We can see it. We can see it.
Yes.
Dr. Parekh, will you read this out, please?
Sure. Human beings inherently care about others. Compassion is an integral component of our social intelligence that has enabled us to survive for thousands of years and thriving. Very nice. Very nice.
Thank you.
Yes,
So
we
it's
shall
not
have some
just
more.
surviving, it also helps us to thrive. We'd like to have
Yes.
a panel discussion with this quote. Thank you.
Wonderful. Wonderful. This was very nice and very touching. Thank you very much, everybody. And as I said, this was a very educative experience for us because we have not been exposed to this knowledge at all. So it was very nice. Thank you very much. Thank you.
Thank you very much, Dr. Siddharth and Mr. Shubham.
Thank you, everyone. Thank you for the opportunity.
Thank you all. Thank you so much.